it's Dr. Shelley, and this video is about why do people fail the NCLEX exam. If you want to know the answers to that and several other wonderful things, then hit the subscribe button because we got a lot to offer. This is HETV, and I'm going to tell you why nurses fail the NCLEX exam. Number one, the number one area of failure for the NCLEX exam is actually basic care and comfort. And you might be thinking, I remember seeing that on my report from the Board of Nursing. Well, basic care and comfort is just that, basic. It's so basic that a lot of these schools that took your $25,000 to $40,000 for your program didn't teach it. Yeah, you paid all that money, and some of the schools make you teach yourself. They didn't even give you handouts, and the teachers stopped mid-drift and either quit or were fired, or you didn't have clinicals because we had this thing called a pandemic. Well, in that situation, you really weren't learning what you needed to learn. So what is basic care and comfort? Well, it's nutrition, it's positioning, it's post-op care, it's cough and deep breathe, it's incentive spirometers, it's crutches, it's canes, it's walkers, it's how do you wrap a leg after it's sprained, it's how do you make an ice pack, it's how do you administer meds, it's comfort care instead of pharmaceutical care. It's what you do as a nurse that's different from a doctor. So what are some other reasons why people fail the test? Well, if you were born outside of this country and you've spent less than 7 years in this country, and the first language ever heard in your ear was actually not English, then you are what we call an English second language student, and you are high risk for failure. It's okay, because I have my PhD in this, so I got you. Now, who else fails the test? Bridge students are really, really high risk to fail the test. Why? Why, Shelley? Why would someone who's an LPN already fail an RN test? Don't they know more than the average? Sort of, but they usually work in areas where it's high risk, not the best care, long-term care. And so they take their job to this test, and this test is not long-term care. It's pretty much based on a lot of hospital care. And so they also take their bad habits to the test, because in the long-term care facilities, there's a lot of bad habits. Now, LPNs to RNs also failed their test because they're working too much. They got to pay for that house, that Mercedes, whatever that they got when they're an LPN, and made all that money. And also, money is so lucrative when you're a nurse that they sign up for overtime and around time and downtime and uptime, which is crazy if you're trying to study for an NCLEX. The other reason why the bridge student tends to fail the test is because they literally thought their LPN test was sort of easy, and they didn't really anticipate the difficulty of this test. Now, why else do people fail this exam? Some people fail the exam because literally they didn't really understand that all the medications are generic. And while there's only 6 to 12 meds on the test average, if you miss those, you're going to get 40. One of my students got 47 meds. So there's a multitude of reasons why people fail this test. 10, 11 times. I think 11 was the record for my NCLEX review course. But if any of those sound familiar, call me, 216-410-0936. Because I got you, I can help you, we can do this.